This is Dr. Charles Parker, and you're listening to Core Brain Journal. It's a place where I connect both fresh discoveries and interesting different perspectives from advanced mind science with the realities of real people and everyday life down on Main Street. Well, welcome aboard, folks. Dr. Charles Parker here one more time, and we go from one very interesting guest to another, and you folks are going to love talking to Alicia Miller tonight, or listening to her. She's going to be talking to you, but in these conversations with a podcast, it's like you're just joining in the conversation with a couple of people who are interested in the very same things that you're interested in. Welcome, Alicia. Look forward to talking to you.
Thanks, Chuck. I'm very excited to be here and to talk to you.
It's going to be so much fun. We're really on the same path. And so what I'm going to do is just do a brief little introduction of our sponsors, and then we'll come in and we'll get a full-on introduction of Alicia, and we'll get right into what she's going to tell us about, which has to do with a whole deeper experience of tragedies and difficulties that you can actually put into practical, useful recovery terms. We'll be back in just a moment on that. So CBJ listeners already know how much we love the reality of data here at CBJ. And today we welcome our clinical friend and new sponsor partner, Direct Health Access Laboratory, with over 3 million studies and their very profound peer-reviewed evidence. They are deep leaders of experience with the big picture of measuring, for example, methylation, cryptopyrrole, and copper challenges. Who cares? Well, they all affect brain function, folks, and we've got documentation to prove it. And we've interviewed some important people on Core Brain Journal to talk about that. Direct Health Access provides a global service with a molecular focus. Stay tuned, more in mid-episode. And CBJ listeners also know how much we appreciate detailed improvements of mind care on many different levels. And today we're pleased to welcome an additional new sponsor and partner with a deep interest in comprehensive, fresh options to address the complexity of adolescent treatment failure. Yes, nationally and internationally. For 80 years, the nonprofit Barry Robinson Center teams in Norfolk, Virginia, provide residential care on an evolved family, interpersonal, and indeed global level, and they are TRICARE friendly. More later, we'll talk about that mid-episode. So let me introduce Alicia to you. She has a personal healing journey, one of compassion and deep unconditional love that has given her the gifts to help men and women experience their own acceptance and freedom. In our culture and most of our families, we do not receive the support to process many of our emotions, and so we continue to repress them by distracting and numbing ourselves, and through controlling and addictive behaviors, we keep trying to get it right, and it doesn't work. Alicia realized that unprocessing emotions causes chronic emotional and physical symptoms. I didn't say the unprocessing gets you well, that the unprocessed emotions themselves cause the chronic emotional and physical symptoms. Sorry, I misread that, Alicia.
No.
And so she helps her clients to see the symptoms and triggers as a gift to value all their emotions as a necessary part of their authentic selves and build their recovery therefrom. Alicia's own extensive journey has begun in a healing systemic candida, which was one of the reasons I wanted to talk to her, because, of course, we're interested in some of these biomedical problems that go undiscovered. And it gave her the experience to guide hundreds to freedom from digestive problems, chronic fatigue, anxiety, depression, autoimmune disease, eating disorders, codependency, get that word, addictions, poor body image, and perfectionism by healing the emotional root that was a cause. And what she wanted to do is to have and help them live a fulfilled and inspired life in the process. So she's an author. She's written a book, Detox 101, another one called One Crazy Broccoli, and What's Left to Eat. And she's writing her own book called Your Symptoms Are a Gift. We got true bonding on that point. It's an inspirational guide to help readers take action and ownership of their well-being and to help heal them from physical, emotional, and relationship challenges. Thanks so much, Alicia, for joining us. So tell us about where you are now, what you're doing, and give us a little idea of kind of who you are as a person to start that narrative.
Who am I?
Yeah. What do you do? Yeah, a little bit about you personally.
Well, personally, my life is drastically different than it used to be, and I am really in my full, I believe, expression of my gifts, and my partnership with my husband, who's doing the same work as I am. And we're just having fun traveling and helping people heal themselves and their relationships and their bodies. So we have 3 dogs. We love to travel, and we're lucky to have people that stay at our house and take care of our dogs while we travel. So
Fantastic. So do you, with your courses, let's talk about what you actually do together. Let's get a little bit of an idea of the application of these ideas, and then we'll talk more about how that Candida took you down the path.
Yeah, sure. I developed a core emotional system for healing. And so it's a core emotional healing model that actually I have taught to my husband, who's a clinical psychologist. And so he's using it in his practice with his clients, and we use it together with our work with couples. Now, I work mostly with women because the model that I develop works most effectively in groups. And the women that I work with, a lot of Candida sufferers come to me because they've tried everything else on a physical level, treatments, modalities, energy healing, you name it, and nothing's working. And so they realize that it must be emotional, but they don't know what to do. So I lead them through a very deep, supported, safe space in my programs, which are in person in retreats in Costa Rica or online during a 60-day core initial process. And I do women only with the group setting because most women have experienced a lot of trauma and abuse from men. So this creates a safe space for them to be supported to heal from that. And so I also work with some men who are very sensitive and intuitive healer types. I work with them privately, but my husband works with most of the men that come to me, and I refer them to him because he works with men in groups as well and privately.
So where do you go in Costa Rica?
We found the perfect place for the type of work that we do. My friend and colleague Janet Raftis does the retreat with me. She's an energy healer, so it complements the deep emotional work. And we found this place on a crystal mountain. It's 5-star, luxurious wellness retreat called The Retreat.
Oh, it is. Oh, that's interesting, huh? Well, that would be it'd be a fun trip because you could go have transformation on a number of levels all at one time.
Definitely.
So let's talk about that personal self-discovery thing, that whole Candida thing. You know, we've been interested in it, as I mentioned before, at Core Brain Journal and in my own practice clinically. How did you discover it? And then how did that actually take you to this next level of emotions as they relate to Candida?
Oh, yes. Well, I knew I had Candida overgrowth for many, many years, and I was just kind of managing it like most people do, or treating it here and there. And I was constantly detoxing and cleansing and trying every supplement and program I could get my hands on for maybe 10 years. And then I went on a kind of somewhat spiritual journey to discover myself and follow my heart. And I moved to Thailand to research the healing and detox retreats over there. And when I was there, I got confirmation that I had systemic Candida. And then I made the commitment there to finally heal and would do whatever it took. And so I did a really strict diet for about 1.5 years and a lot of tons of supplements. I saw a lot of holistic practitioners. I did vibrational therapy and everything I could really get my hands on, acupuncture. And then I would kind of notice the flare up of symptoms with my not even emotional state, but certain patterns. Whenever I didn't believe in myself, or I'd give my power away, or I didn't feel supported, my bloating would flare up.
Mm-hmm.
So I started to notice it there, but I didn't make the full emotional connection until I got back to Atlanta and into a relationship that was an old pattern of mine, a codependent one,
Mm-hmm.
where I gave up my needs for crumbs, really.
Yeah.
and then
Both literally and physically. I mean.
yeah. And I thought I was healed from Candida at that point,
Mm-hmm.
and I was a little restricted from food, and I was still experiencing emotional eating, so that kind of never went away. And then those are all related to the same root cause I discovered. So in the relationship, my symptoms flared up again. So I had extreme yeast infections and bloating, and I just had this aha. I was like, this has got to be emotional, because I wasn't eating anything or drinking anything that would have, fed it. So I actually had a healing session with my friend Janet, who does the retreats with me, because she had a parallel healing journey as well with Candida and codependency and giving her power away as well. So during a healing session with her, she saw that it was really my inner child knocking to come out, and that there was more work for me to do to help myself feel lovable and process more repressed anger. And so I applied the work I was doing with clients and training that I've had over the years, and I really created this model from my own experience of what worked for me, and doing the inner child work and processing emotions, setting boundaries, and really supporting myself on an emotional level and listening to my emotions, which ultimately healed me from my Candida symptoms. And I never needed to restrict my diet again, and I didn't have emotional eating anymore. And then I met my soulmate, Doug, shortly after that, because I felt lovable, and I found someone I finally loved and supported me, because I was doing that for myself.
I mean, that sounds so beautiful. I want to ask you some questions, though. Forgive me for putting my psychiatric hat on, because I know our audience is asking some questions just because I know them well. And the first thing is, and this is, I'm going to be careful about saying this, because yeast is more than just a private inflammation. When you say systemic yeast, you're talking about really throughout your body. When you're talking about bloating, you're talking about your bowel. You're talking about, I think a lot of women think it's just vaginal. It's just that's where you get it, and they think about yeast that way. We talk about it with women very often, and what you're saying is, hey, that may be a sign of a you haven't said this, but I'm putting words in your mouth. Correct me if I'm wrong, because that a person can have a localized yeast infection, but they could also have a systemic, and that systemic is frequently associated with bowel. Is that correct?
Correct. Yes.
Okay. So when you're saying systemic, it's a differentiation, but it doesn't necessarily differentiate you out if you only have a localized infection.
Correct.
Because the localized infection could be a sign.
Yes.
Okay. So then the other thing I thought was really important was the phrase of codependency. A lot of people, even today, don't really understand the nuance of that term and what that means. And then we'll talk just a little bit briefly about the inner child and finding that, because people need some structure to the language and so on. And codependency, just as a by the by, can be used. I'm telling you my opinion. So we just, I haven't talked to the audience about this. Okay. So this is like you and me talking about it for the first time, and the audience is hearing it. But I wrote a book years ago in 92 called Deep Recovery. And I was really taking issue, because I was working in addiction medicine with the codependency label, because so many people were using it reductionistically. And really, what the codependency original meaning is, if you're married to a person who is an alcoholic, that the person who's married to the alcoholic is codependent on the alcohol. And my assertion all along is that they're dependent on the person, and that the alcohol is only a byproduct of the whole thing. To say codependency then takes it away from the real underlying meaning of that person's internal challenge with themselves in relationships, period. That same thing would go on if the person wasn't an alcoholic. There would. So that was one thing. Do you agree with me, or do you have?
Yes, I mean, both people are codependent in that relationship.
Absolutely, high five. That's the way I think. So in fact, the counter dependency is codependency. I had a drug addict come in who was going to federal penitentiary for being arrested in New Jersey with a van full of heroin, and he running a 3-state heroin operation. And so he came in. He was a very cool, nice guy. A dude, a definite street dude, and he came in his Mercedes, and I was kind of joking him because I said, look, he was admitted for an addiction treatment briefly. I said, and you, my friend, are a codependent. You probably didn't know that. He says, oh my gosh, I'm not a codependent. And the conversation went on from there. He's going, because that was exactly what we were talking about. So the issue then is, we got some terms on the table. Now let's hear you talk about some of that thing with Candida, what you did for Candida. Do you do anything medically for it, or do you rely just on okay, so go ahead.
I did everything. I started off medically, and then I did it more naturally with diet and natural antifungals and replenishing my depleted everything. And hormones and all of that, and did a lot of cleansing, a ton of cleansing, and saunas, and seriously, I tried everything. And when I was in Thailand, I felt really, really good. My brain fog cleared up after a couple months. My skin cleared up eventually after a year or so. And but my digestion and my bloating continued, and that didn't go away until I did the emotional work.
That's very interesting. Very interesting.
Yeah. That's where our emotions are. We're not processing them. When I say that, if there's repressed anger, that typically will just create everything stopped up there and not flowing.
So you were carrying it. Now we get down to the child within question, which was the third one of those questions. And how does all that work? Do you do, as they do in some of the places like the Karen Foundation, for example, where you do the enactments and the visualization, the activity? Could you talk to people a little bit about that?
Sure. It's just a process that came through me. I didn't study it anywhere, even though I know John Bradshaw's work very well. And I approach it in a different way, where I do inner child sessions and do a guided meditation with them and connect them in a very deep way. And I'm very skilled at responding to what's happening in the moment for the person. It's impossible to do inner child work on your own, because the person, as you most likely know, will start putting their own ways that they related to themselves onto the process, or the ways that they were parented, or they start to get angry at themselves. And so it can be really tricky. Sometimes the inner child, there's such a disconnect because it was not safe to connect to their feelings. So the inner child feels unsafe to connect to. So it's a process that I help them walk it through during that, and also ongoing. So I have a meditation they can listen to, and I help them connect in many different ways through their emotions, through pictures, through stuffed animal, and help them start to learn how to be with themselves in a different way in their emotions, and provide that safety to start feeling and acknowledging how things impacted them.
So how do you help people get over the difficulty of, oh my gosh, I don't know if I want to do something like this with people?
Mm-hmm.
Because I think that's a natural concern. People have a problem. They don't want to have a problem publicly. And then how do you actually help people get through that part of it?
So initially, it's just providing the insight for them around this safe space is actually going to provide the environment that you needed as a child that you didn't get. So where you can share, and as you know, sharing in a safe space heals shame. And I'm very skilled at creating the safe space so they can be seen and heard and validated and understood, and just all of those ways that they can practice being vulnerable will help them heal on a very deep level, and just assuring them that no one actually feels comfortable at first, but that changes quickly where they start to feel the connection they've been craving their whole life with other people who are loving and supportive and cheering them on, or they're being understood for the first time. Mm-hmm. So that becomes one of their favorite parts about the program or retreat.
So at the risk, that was my own curiosity that was getting a little too deeply into Candida. So I think one of the things that's important to bring up is the fact that the individuals that you've been working with, and indeed the individuals that your husband has been working with on these retreats, many of them have been traumatized and have significant developmental arrest behind the experience of that trauma, and don't know what to do with it, and don't know where to take themselves as human beings with that trauma experience. And that's something it sounds like you get into.
Yes, definitely. And the reason why I say your symptoms are a gift is because most people don't know they had trauma. A lot of people that I work with are so in their defense that everything was okay that they didn't acknowledge how traumatic their childhood was, or how abusive it was, or neglectful it was. And that's why the symptoms, I love working with that. It shows them that there is something for them to address that's unresolved and that wants their attention from their past.
Now, do you have them actually work through, I've seen different people do different things, and I'm certainly not advocating a position. You do this far more than I do, because in my practice, I just don't do this thing, the kind of things that I'm going to talk about. But I've seen people actually feel that if they had, it's sort of a cathartic theory of mental health, if they get with somebody and express it, that somehow that takes care of it. What's your thought about that?
Express what?
Well, like the affect or whatever. I mean, I've seen people look like that's the be all end all. Just get and express it, and somehow there's.
Do you know the name of my 60-day program?
No.
Express what's repressed.
Okay, well that's good. So it's a step in the right direction.
Yes.
But I think if you are saying that, I'm going to guess, because of who you are as a person, that you do far more than that. I mean, that's not the end of it. I've had people, you're just saying, let's find out what it is and go from there.
Yeah. I mean, we're talking about repressed emotions at the root of chronic symptoms, behaviors, and patterns. So in order to heal from that, affirmations and changing your mind isn't going to do it. It's actually expressing and feeling and allowing yourself to grieve or to go into depression and sadness and anger that was unexpressed. And then that it does connect them more deeply to their true expression. So if they're blocked emotionally, they're going to be blocked from their intuition and their inner guidance system and who they really are. So there's tremendous value from understanding why we have emotions and their purpose, and all emotions are healthy. So it helps everyone start processing emotions instead of doing everything to avoid feeling in many different ways.
See, that's so articulate and so real. You're really taking them to who they are as a person.
Yeah.
I think one of the things that I had seen people do is just go and beat a pillow, for example, you know, and like, okay, that's it. Okay, you should feel better now because you've had that cathartic experience. And what you're saying is it's really more involved than that. It's
definitely.
It's not good.
And that's why so many things don't work for people, because they may go to some parts of this process through maybe a weekend course or a therapist, or either EMDR and EFT are all very useful modalities, but there is a process for each person to learn of how to work with their emotions on an ongoing basis and how to respond to them appropriately. And our emotions even tell us when to set boundaries with ourselves and other people. So it's a whole, I teach a course that's supported, really. It's not, it's more than a therapeutic model. It's an educational based system as well.
That sounds interesting. So
I would love to have a reparenting school.
that would be a great one. I mean, and then the next thing would be how kids could talk to each other, that sort of thing. Where you have a whole peer relationship management situation where they can start as kids in terms of how they manage themselves in the peer group. Yeah.
Well, my stepson is addressing that with his company.
Oh, is that right? Oh, that's interesting.
He's teaching social, emotional skills and mindfulness and entrepreneurship and coding skills to underprivileged schools.
Well, that's interesting. So then the question that I'm going to come back with in just a moment, we're going to take a little break here. And one of the questions I'm going to come back with is, how do we then take some of that into our daily lives, even if we don't go to your program? What are the things you've learned from the numerous people that you've seen? Maybe one or two concepts that a person can take this, okay, this isn't going to answer everything, but this is some way of thinking about next steps that would be useful for you, that are a beginning. It's not going to be the end. It's not going to be the entire thing, but it's like, here's a way to get started, I guess, is the question that I'll ask in just a moment.
Okay.
So we'll take a break, folks, and we'll be right back. Well, folks, you know as well as I do that psychiatric treatment failure, especially after multiple medication trials and those very, very brief hospitalizations, may prove insufficient to deal at home with the complexity of troubled children and those adolescents from 6 to 17 years old. Improved care, those next mandatory steps, should include a more comprehensive approach to address those multiple levels of challenges, from family to peers to school, diagnostically from defiance to depression, on every level for families, including military families internationally. The Barry Robinson Center's 32-acre open college-like campus in Norfolk, Virginia, provides safety and security and clean, comfortable living. How do we know? We refer folks over there all the time, strongly endorse what they're doing. So for further information, an informed interview, connect at this page, barryrobinson.org/core. Well, you folks already know that here at Core Brain Journal, we're on a mission to introduce you to resources that make significant contributions to the investigation of those predictable mind science applications. Our colleagues at DHA Lab Group provide a real difference with treatment options for people at every level, from first awareness of mind problems to those frustrating times when even well-informed treatment becomes surprisingly unpredictable. For my entire professional life, from psychoanalysis to brain scans, I've searched for, yes, improved predictability. The good news for all of us, from professionals to patients, remarkably effective research offers useful, cost-effective, organic options far beyond guesswork with psychiatric medications alone. DHA lab tests measure unbalanced biomedical details through easily available testing, now available globally for a variety of molecular answers from, for example, methylation, copper, and cryptopyrrole challenges. Check in for more details at dhalab.com core. That's dhalab.com/core. Okay, folks, we're back with Alicia Miller, and we are having a very interesting, deep, transformational moment here we're identifying with those folks that got developmentally arrested sometime in their childhood, and they're having this sort of coming out of themselves and really identifying who they actually are and who they want to become, and how to handle boundaries and so on. Alicia was just talking about it. But the question that I posed just before we took a quick break here with Alicia was, how does a person on the street out in, Bird's Nest, Virginia, start thinking about what they can do with themselves tomorrow to begin that reconstruction process constructively based on what you've seen with the numerous people that you've worked with?
Well, I think the education is key, and I do recommend a couple books just to become more aware of what our emotional needs are and how they weren't met in order to start connecting to that. So there's so many great books out there. There's one on emotions. I think, most people don't know the purpose of anger, and there's a lot of beliefs around there that anger is not healthy, or it's not you're not a good person, or it's because they associate it with violence instead of healthy. Anger is just a natural emotion that alerts us to say no, this isn't good for me. Or someone's disrespecting or even abusing you, and you need healthy anger. And oftentimes that's repressed, and that's what creates abusive relationships, is when it's been repressed. So there isn't a healthy anger response to say no. So The Language of Emotions is a great book by Carla McLaren, McLaren. And she's awesome. She's amazing. There's just so many great books on emotions. So I think that's
a good start. That's something they can start in Bird's Nest. They can start to think about what's going on.
Yeah. And to understand the emotional needs and dysfunctional families. A lot of people are not aware of what is dysfunctional and what they didn't get that may have impacted them as children. A very short book on that would be Healing the Child Within by Charles Whitfield. And then I love Alice Walker's work as well. So the Drama of the Gifted Child.
I'm writing these down madly. That's great. Thank you very much. We'll get them in the show notes. Those are great ideas. So the other thing that occurred to me then was to take this a little bit further. I know there's a little bit of a gender split, but please correct me on this, because I think my experience is that women can be just as tight as guys about the denial of underlying vulnerability. That guys are certainly more prone to it just because it's not a guy thing. And the whole counterdependency thing that I was talking about with the heroin addict, like I'm okay, and and of course his wife got the Mercedes, and we went to prison. So the issue there is how do you then help a person? A lot of times an individual who feels like they've been victimized and is in pain is more vulnerable and open to talking about the pain as it has occurred to them from a victim point of view. But I think one of the harder things to deal with, and I'd be interested in your remarks or thoughts about this, is the challenge of counter-dependent individuals who really are counter-dependent because of their underlying vulnerability and push people away and take commandeering roles. I don't know anybody in politics like that. Take serious counter-dependent control things instead of actually identifying what the underlying vulnerabilities are. So you have any thoughts about that whole process?
Yes, and you're right. That's the gender, or the traditional male versus female. You can see the commonality out there of men who they're totally disconnected from what they need. They don't know what they need. They can't ask for it, but they try to get it in more demanding ways. And then a traditional woman would be one that totally gives up her needs for the other person. and is scared to ask for what she needs, or doesn't get the response that she needs if she asks, because and both are typically coming from toxic shame. And that's a whole other term that we can define, but there's the shaming of emotions is the problem, really. So men feel shame for having emotions typically. The men don't cry, and they're called all kinds of names and get beat up for being vulnerable. And they do have it worse than women in our society to show emotions and to be sensitive. And so that their natural emotions are shamed. And so they feel shame for, not being what the woman needs and having these needs and not being able to express themselves. And then the woman responds in a different way to shame, where she has to perform or be perfect and do everything. So, and neither one of them maybe don't have access to really how they're truly feeling and how to ask for what they need based on how they feel.
That is a very interesting point. I mean, the way you amplified on that, you hear very often people talk about toxic shame, but that last little wrinkle is such an important point. The shame of the emotions in the first place, whatever they happen to be. Instead of dealing with them and understanding their underlying value as a gift, as you say in your book, where you're going somewhere with this understanding, as opposed to just working, negating it and or dancing around it one way or another.
Yeah. Even our needs were shamed oftentimes as children, of, not being asked what we wanted and being told how to feel or what we should do. I work with a lot of clients who were the caretakers to their parents because their parents were wounded and needed them to be there for them and make them happy. And so that totally is an abandonment of who they are, and they abandoned what they want. So it's a process of reconnecting to, what do I want? How do I feel? And responding from that place. And that's your authentic self. That's everyone's authentic self, of moving from feeling loved and validated for, what you're doing, or being there for other people, or how you look and how much money you make, to valuing your emotions and taking care of your emotional needs. And then that kind of reclaims your self-worth for not based on what you do, but based on how you feel.
Yeah, so the validity, who you are as a person, is you're just in contact with yourself as a person, as opposed to living someone else's life. I mean, this is who I am. This is what I feel. This is how I think. And it's credible, and it's not uncredible. Then the issue is, how do I then use it effectively to guide myself through a contributory life? Where can I go with my life with this? Yeah, very doggone interesting. I mean, I hadn't quite heard about it that way before. I mean, it was interesting how often I got, and when I heard others talk about it, into the cathartic experience as an endpoint. And that's why I brought it up earlier, because it's sort of like, if you just experience it, that somehow then, and Freud was with this. Now, Freud threw out the cathartic theory of mental health before 1900. He said, that's not going to do it. That's why we're going to do this psychoanalysis thing. We're going to get down to so I thought that was interesting, but it's one of those things that we see all the time.
Yeah. So then Carl Jung was more aligned with, going into the darkness, and, it's all about the soul and the soul's expression. And
yeah, I was a hair's breadth away from becoming a Jungian analyst. I went to Switzerland and I was thinking about it, and went to his shop there. I think it was in Zurich. I can't remember now, but it was another tour, because of course he had the more spiritual transformational portion of it, where you actually, and the whole archetype things, and you really think about who you are in your message. So what's our takeaway? First of all, let's talk about how we can connect with you. And this will be on the show notes, but Alicia, just fill us on a little bit on that, and we'll get tightened up with that point.
Sure. You can find me on my website and pretty much all social media under Elicia, ELICIA Miller. And my website's EliciaMiller.com. To learn more about the core emotional healing model and my extensive journey, personally and professionally, you can go to EliciaMiller.com/free-webinar.
See, that's going to be great. I mean, we're going to have that on the show notes in case you didn't. If you're riding in the car and heard Alicia say that, it's going to be sitting right there on the show notes. And I have to look at it. I'm looking forward to it because this has been such an interesting conversation. I mean, it's funny, having been around the mental health field for a long period of time, what happens, I think the slow but sure core change that's taking place is that we're looking at the reality of the internal evolution of people and facilitating that as opposed to guiding it and telling them what to do. I think so much of medicine has been a vertical management thing, like, this is screwed up, do this, or you're sick, take this, or whatever. And your mission is a very worthy one, as I'm sure our listeners will agree. It's how do you find yourself and do something with that? How do you actually fulfill yourself emotionally and spiritually in a contributory way for humankind? How do you actually do that? And you have to know yourself to do that,
Yeah. And both you and I are helping people look at symptoms in a more empowering way and not feel victimized by it, but, using it as another support, messenger for you of saying, hey, there's something for you to address that's not about your symptom. It's about how you're not living to your fullest potential.
Yeah. That is so well said. What a delightful place to end. So, Alicia, thank you so much for coming on board. It's been a great conversation.
I loved it.
If you think of something that you want to talk about down the road, I mean, if you want to go more deeply into experiences of toxic shame, I would be happy to do it with you because it would be very instructive. I've learned a lot from this, and I just appreciate you coming on board.
Awesome. Yeah, I would love to. Thanks so much for having me here. I really enjoyed talking with you, Chuck. Thanks.
Thank you. Thanks for listening to Core Brain Journal. We're working every day behind the scenes to bring you reports that connect research benches with those street trenches. Here we share the complexity of mind science because, as you know, details really do matter. One of the most pervasive, misunderstood challenges is how commonplace medications, like those written for ADHD, are used so regularly without clear guidelines. If you think you'd like more specifics, take a minute to download my 2-page PDF packed with video links and references on the absolute essentials of how to start ADHD medications. They're easily available at corebrainjournal.com/start. Thanks for listening. Do connect and stay tuned. Together we can make a difference.